Hi everyone, this is Dave and represent for APAC sales team.
Hi everyone, I'm Missy. I'm responsible for EMEA sales team.
Today we are going to share our success cases, but before sharing our story, we would like to talk a little bit about the medical trends, and that's more easy to understand what prospect wants. Missy, I think you can help to share with us.
Sure. So we Avalue focus on health solution for many years. Over time, this is already the third year of the pandemic, and a lot of things has been changed. Future health system will need to deliver care that is more accessible, scalable, and equitable, while helping to preserve the health of the planet. So we sort out 4 healthcare technology trends, showing how digital and innovation can help us to get there. So Dept, do you have any ideas?
Okay, well, I think the first trend is the AI in healthcare. Nowadays, one of the most pressing sources of the stress and burnout in healthcare is that the highly capable professionals spend too much time on the routine task, but patient. Okay, and it's around 42% of the healthcare professionals feel burned out.
Wow, that's really annoying, but I believe they will need a good solution to help them.
Yeah, I agree. For example, in radiology departments, imaging staff says almost their 25% work is inefficient and could be automated. In previous sections, we have talked about what's our capability of the medical AI. So next part, we are going to share how we cope with these troubles. Okay. And the second trend is the telemedicine. Because of the pandemic, the use of the virtual care has skyrocketed in recent years. Yeah. And study shows the telehealth use has increased 38-fold during the pandemic, and that's a big jump.
Wow, so it's a big jump, but I think some of people, they don't know what is telemedicine. Would you share with us?
Yeah, sure. Simply put, the telemedicine uses the communication technology to deliver the healthcare services to patients at a distance, such as the video chat via apps or webcams, phones, or any other video conference software. And it helps prevent the spread of the COVID-19, the flu, and the other infectious diseases.
Okay, that's interesting. And the third one I would like to share the trend is the IoT solution. And under pandemic pressure, the healthcare environment are looking for reducing human resource and increase management efficiency. Hospital leaders and the healthcare customer is facing an unexpected surge in patient demands. And the ability to adapt to the rapidly changing circumstances has become much more important than before. And as you could understand now, time is money, but also life.
Okay, so Missy, so what could we do?
Such as real-time location system and indoor locating system is now an interesting technology. IoT solution could predict a potential bottleneck in patient flow in real time to prevent them before they happens. Okay, so the last one, the fourth one, is the eco-friendly e-paper. Since the COVID pandemic has been created an urgent needs in the health sectors, digital health solution has been identified to take this challenge. And the e-paper is one of them to offer more service at facility closer to patients. An e-paper display combined with the infinity transmission technology is connected to the hospital system to automatically update information without the handwriting updates by hospital staff. And it could save a lot of time, but also can reduce the occurrence of doctor-patient disputes caused by information errors. And family members of patients can also communicate with doctors in real time through the information board, which can be displayed even power is out. So I think that's the benefit of the e-paper.
Wow, that's great.
So we expect e-paper will empower smart medicine and provide patients better service. So that's all the 4 healthcare technology trends we sort out to give you a brief idea of our target market and show you how we scope with these pain points. And next step, let's move on to case studies.
Okay, and this is a medical AI solution we built in Taiwan hospital, like the Wanfang Hospital, the Cardinal Tan Hospital, and the Tree Service General Hospital, for accelerating the alignment and the variant detection on the diagnostics disease like the osteoporosis and the cervical cancer. So we now have this tool to automate such tests to kill the pain points, which is to relieve the burden on the imaging technologists and focus more on the patient care. Okay. And we also help the hospital to improve the efficiency and reduce the time cost.
Oh wait, so how much time we need actually?
Okay, according to our estimation, it's around 6 seconds for the osteoporosis and 2 minutes for the cervical cancer to get the result.
Wow, that's quite a lot.
Yeah, and it also reduced the false negative rate. We have 2 models for selections. Both support the racer car, okay, and we have the MAB2 T600 and the HPS 621D4A, the black one. But the HPS 620D4A provides the better performance because it supports the 2nd-gen scalable processor. Okay, and it's also a new partnership with Avalue and the precision medicine market. And we want to find the new ways to develop the new medical tools and solving global health challenges. And next, this is the telemedicine car cases, and this is a telemedicine solution for a tele-ICU case. And physicians want to extend the critical care resources to the bedside. So no matter where the hospital is, in this case, the intensivist in Vietnam hospital used the Avalue Telemedicine solutions, including the medical panel PC with the expansion power bank like the HID 2132 or the HID 2138, and the medical car webcam to remote the ICU bed at the time. And we integrate with the HIS and the APAC system through the RESTful API by Dept. So, and it also support the app via the 5 technology, so that we work with the VTEL and allows for the better remote patient monitoring system and the sharing of the high-resolution medical images. And we also help the hospital to reduce the contact infection and improve the work efficiency and enhance the patient experience. That's all.
Wow, the telemedicine sounds really great.
Yeah.
So coming next, I would like to share about the IoT case study. It is about the UWB Solution. So in post-pandemic period, it made people more concerned about their health. So in increase of the member health center is facing the problems of inefficiency, manpower, and rising management cost.
Okay, Missy, so what kind of the solution the Avalue provide to the customer?
So Avalue is now offering a high-quality equipment in fully precision preventive health management. We call it UWB Solution. And now it is used in several health centers and hospital exam rooms. And the health center is getting more staff members who often need to be responsible for medical health check objects. It could be difficult to find the target immediately when their members is in different corners. So with Avalue UWB Solution, with the hardware integrated with software support Avalue's ARTMIS, asset and the staff positioning questions could be solved and provide the geofencing prevent patient from accidentally enter dangerous or wrong areas. And it also improves customer and patient certification with the fluency of the process. Okay, so the last one is the eco-friendly case study. First of all, I think people are familiar with Epaper technology. However, I would like to give some highlights about the benefit of Epaper. So Dept, do you have any idea about the benefit of the Epaper?
Let me think. I think it's maybe easy to install and implement, or maybe the low power consumption?
Yeah, exactly. So it could give the hospital building friendly and also time efficient and lower cost saving. Avalue has successfully worked with a partner for several cases which adopt Epaper in hospital. As you may know, like hospital could usually with ages, and it would be difficult to have the hardware revolution under the intensive, busy environment. Hospital patients want information to know who is taking care of them, and what tasks, therapies are scheduled, and what are their restrictions, and what they really want information in real time through their stay in the hospital. And Avalue has found out the pain point of a building limitation and provide easy installation, eco-friendly product to customer. And the first case in the negative pressure isolation room in Taiwan, National Chen Kung Hospital. The second one is in the emergency department patient room in the United States. And both cases have been facing patient communication board demand increase, especially under the pandemic period. And Epaper can empower the smart medicine and provide a patient much more humanized and higher quality service. It is also what Avalue contribute to the green technology in the urban developments. So I think that's all about our sharing today.
Thank you, Missy. That's all our sharing today.
Thank you, Dev. And last, we would like to invite Joyce to give us a sum up for today's section. Let's welcome Joyce.
Welcome, Joyce.
Thank you, Dev. Thank you, Missy. We at Avalue have dedicated to healthcare solution and always helped our customers to increase case volume and access to high-quality critical care while improving margins, such like
we already provide to European Tier 1 medical customer for hemodialysis and ultrasound applications.
And moreover, for many years ever, we now have some medical solution like the image-guided therapy solution to the customer. And we also have provide some long-term support for them.
We are also a strong and reliable team to the customers. And in the near future, we will allocate more resources in developing medical projects. Avalue has confidence to conquer any critical challenge. Once again, thank you for your listening today, and hope to see you soon. Bye-bye.
Bye-bye.